If you have chronic pain on the outside of your ankle, you might have issues with one or both of your peroneal tendons. In this video, I discuss the peroneal tendons and the signs and symptoms of these ankle injuries and why military veterans often suffer these problems. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Peroneal tendon disorders are a very common cause of what we call hindfoot and lateral foot pain. The peroneal tendons are basically, and my model doesn't show them on here, but this is a model of the ankle. And this would be, if I can hold this here, sort of the inside of the ankle, tibia, fibula. The peroneal tendons are tendons that run behind the fibula, around the back and outside of your ankle. They help turn your foot out and help with eversion on uneven surfaces. Now, there are sort of three primary problems with peroneal tendons. You can get a peroneal tendonitis, which is just an inflammation. You can have peroneal subluxation, meaning those tendons basically slip out in front of the bone as a result of a traumatic injury, and then just chronic ankle pain due to tendinosis within that tendon. Now, in the military, if you have a traumatic event that basically, and it can be a bad ankle sprain, or that may be what it seems like, where you get a tearing of the sheath that holds those tendons behind the lateral malleolus, and now those tendons are popping back and forth, you're going to know it fairly quickly. You'll get those tendons popping out in front of the lateral malleolus, the outside of the fibula, and it's very hard to do anything. You'll probably get surgery for that, quite honestly. And if you're in that group, that is very, very easy to get service connected. That was very clearly a result of a traumatic event. You know it fairly soon after it happens. You get treatment for it, things like that. Where it becomes a bigger problem or challenge as far as service connection would be more the chronic pain on the outside of the ankle. Maybe you had an ankle sprain or repetitive ankle sprains or wear and tear, and then years later you get an MRI of the ankle and it shows tendinosis or degeneration, usually of the peroneus brevis, one of the two tendons back there, as it goes around the back of and outside of the ankle down to the what's called the fifth metatarsal on the long bone on the outside of the foot. And it's more of a source of chronic pain. And that absolutely can be service connected. It's easier if you did have medical evaluations for ankle injuries while you were in service. Not absolutely necessary, but that certainly helps. But sometimes you could say, all right, I did all of these different activities while I was in service over a long period of time, and I started having lateral ankle pain, got an MRI with an orthopedic surgeon. It showed this. I could, and I have very credibly made that argument in Nexus letters to good success. It's just a little more challenging than the traumatic injuries where the tendons basically start to sublux in front or outside of that lateral malleolus, that bone, as the result, again, of a traumatic injury. So it's worth talking either to your doctor or to an orthopedic surgeon like me, kind of go over your case, or at least let that doctor or orthopedic surgeon review your records and see if that's something that potentially could be service connected. A lot of times it can be. It just depends specifically what the issue is in your case. All right, if you have ideas for other videos related to Nexus letters, injuries, injury risk factors, things like that, and you'd like me to record a video on those, suggest those in the comments below. Also, make sure to subscribe to this channel. Click the bell to be notified when I release a new video. If you have an orthopedic injury or medical condition that you'd like to discuss me potentially helping you with your Nexus letter, I'd love to help. Click the link in the description below this video and you can contact us to learn more about working with me and my team. We try to make the process as easy as possible for you. We try to get the work done as quickly as possible. And I really try hard to write a Nexus letter that gives you the best chance of success in your disability claim. I look forward to working with you much, much more. Thank you for watching.